maybe even more so in children, although it is difficult to parse the data that we are being shown because we are not generally being shown all of it, as always. The data are juked all the way down at some level. Even more so for children, to the extent that children suffer from COVID, and the vast, vast, vast majority of them do not, to the extent that they do, they almost always have a comorbidity, and obesity is one of the major ones for children as well. Children don't die of COVID, and they don't get sick from COVID. Here is the CDC's data. I'm trying here to go to the government's information, the CDC, the FDA, exactly the people you would expect. If they are not giving us everything, they are going to err in the direction that serves their narrative.
Yes.
As opposed
even
to,
by their own numbers.
Even by their own numbers. What we have here is deaths. This is through 12/15/2021, so it's updated regularly, starting with January 1st, 2020. Each line is it's split by sex and age, total deaths in that age group for this period of time, and deaths attributed to COVID. I will say, they say COVID-19 deaths. I'm going to say deaths attributed to COVID because increasingly that's one of the ways that we are sure that the data are being juked, for instance. And
yes, it's one of the places that the literal bodies are figuratively buried is by categorizing things. And it's clear, you and I have been through this multiple times, it is clear that there is a narrative that starts this, right? COVID is to be maximally terrifying, and the one-size-fits-all vaccine policy is to be maximally beneficial, and things are moved by category in order to reflect that narrative, even though it's clearly not a straightforward conclusion.
Exactly. So for those just listening, I'm going to scroll down. I'm going to try to. No, it doesn't want me to. And show that as you get to, as you go up in age, again, this is just girls coming into women. The number of deaths in the age group increase because deaths increase. You have a lot of deaths in the first year of life because we are born fragile and we become anti-fragile with age if we are allowed to be. But we are born very fragile. And
fragile and easy to misplace.
We never did that. I swear to God. That's what screaming's about.
Yes, that is what screaming. Yeah. That's how it starts out.
Yeah. So the overall deaths in the group, unfortunately, you can't. Well, actually, here, sorry. I can't. Oh, nope, don't show that, Zach. Sorry. Here we go. Yeah, you can show this. This is just the same data in a spreadsheet where you can see that, and I didn't make the formatting nice. The number of deaths increases as you go up, and the number of COVID deaths increases up until, the number of deaths in women over 85 is well over 1 million total deaths, and the number of COVID deaths attributed to COVID are over 100,000. That's consistent with the kinds of numbers we've seen. And now we start over. This is now males. And again, it starts out super low and it just climbs and climbs and climbs. And if we look at just the 18 and under mortality data, we have a total number of deaths attributed to COVID in people under 18 in the US is 655 across the entire pandemic, 655 deaths in the US for people under 18. And if you take out that first year where you're super fragile and even more so, who knows to what extent those dead with COVID was actually dead of COVID. If you take those out, you're less than 500. You're at 492 total COVID deaths, according to the CDC's numbers in the US across the entire pandemic. So what does that tell us? That tells us, again, that children aren't dying of COVID. And that furthermore...
Well, we got to be careful. I mean, obviously 500 is a lot of kids. It's a tiny number.
It's a tiny number compared to all of the kids who have died. And the fact is that compared to every older age group is a tiny number. So yes, it's not binary. It's not zero.
Yep.
But it's actually closer than any other demographic description of a disease progression that I've seen.
Well, I would also leave open the possibility that it is zero, given the noise, but I just want to say 500, if that's the real number, right? It's not zero. It's a large number of kids in absolute terms, but compared to other causes of death, it is very tiny. And I think I know where you're headed here. You were not headed somewhere further.
I'm going somewhere further, but I didn't think you were done with your sentence. Sorry.
It was one of those sentences that just ended abruptly in the middle. There was a sentence cliff, and
I see. Okay. Well, man, nothing is working quite. So one of the places I wanted to go from here is to show this FDA document that came out in October 26, 2021, called Vaccines and Related Biological Products Advisory Committee Meeting. This was a document prepared again by the FDA in service of allowing mRNA COVID vaccines in 5 to 11-year-olds. So again, the point of this document is to provide evidence that what we need are EUAs for 5 to 11 for the vaccines to be allowed in 5 to 11-year-olds, which of course, as we know, were granted. So again, just like with the CDC data, I'm going to the source that I would expect to have to be biased towards the narrative, not away from the narrative. And yet even here, we find things that don't quite fit with the narrative. Here's their page 4, and this is a PDF that I'm showing, but I'll post the link in the show notes. This is COVID weekly cases in across all age groups. And it looks scary. Look at those peaks. The peaks for all age groups. You have the light blue line is lowest. That's 0 to 4-year-olds, and it basically the peaks get higher the older the age groups are. But the peaks are mirroring one another to some degree. Okay, that seems like evidence that you might want to be thinking about. But then you go to page 11 in this document, and what this is doing for those just listening is tracking flu hospitalizations and COVID hospitalizations, flu from 2017 yearly, from the 2017-2018 year, flu season 2018-2019, 2019-20, 2020-21, and then COVID from the beginning, or actually from October 2020 through September 2021. So a comparable amount of time they've controlled for the amount of time. And what we find here is that, yes, mitigation measures have been in place. And so you would expect, hopefully, COVID was spreading less than it might have been, and that flu was spreading less than it might have been. But check out that flu cases are effectively 0. There are 9 pediatric influenza hospitalizations reported in the 2020 to 2021 flu season. 9. Compared to in other years, we don't actually have the absolute numbers. We just have rates per 100,000 of the population. The rates are so low from last year that it's effectively 0, as you can see on this. And they, of course, have not given us the actual ability to compare apples to apples here. And the COVID hospitalizations are lower than pediatric hospitalizations from flu in previous years. Again, there were mitigation measures in place, but still, what happened was flu dropped to nothing. So none of those hospitalizations happened. And we know that at least in some cases, some of the tests that were supposedly testing for COVID were impossible to discriminate between whether or not they were testing for COVID or flu. So how many of these COVID cases were actually flu cases? We don't necessarily know. We don't know.
And I will say the flu number dropping to 0 could be a lot of different things. It could have a lot of different contributors. And we need to point out that one possibility is data shenanigans, that basically if it coughs, it has COVID kind of a thing. More likely, I would say, is the strong possibility that flu has become very well adapted to our modern way of life. And we thoroughly disrupted our modern way of life and interrupted its ability to transmit. So flu had a rotten year because we just simply weren't behaving normally.
Poor flu.
Yeah, poor flu. But anyway, the overarching point is, from the perspective of addressing the hazard to children, that hazard has to be scaled relative to flu in an average year. Yes. And the question is, are these vaccines something that one should offer to children, should mandate for children, encourage for children in light of the scale of the hazard? Yep. And The problem is that, they've gotten in the way of every piece of the analysis that rational, independent people without a dog in the fight would have to go through in order to figure out what the comparison is.
Yeah.
But at the very least, even if we knew nothing of actual harm coming to children from these vaccines, which is not the state we're in, but even if that was the state,
Yes.
you would have to rate the risk that there was something that would happen to these children, if vaccinated later in life, as too large to contemplate in light of the very small risk that comes from COVID itself, even given the way that numbers are calculated to inflate that hazard.
I absolutely agree. And 2 more slides from this document that the FDA produced. Here we have children aged 5 to 11 years hospitalized with COVID-19. This is March 2020 through August 2021. And what we don't see here is this is outcomes in children versus comorbidities. That's underlying medical conditions. But what we don't see is a number of how many kids who ended up hospitalized with COVID had any comorbidities. That's the number I want to see. And I don't see it here. But what we do see is how many kids who were hospitalized had greater than one. Oh, no, that's equal to or greater than one underlying conditions. That's 68%. So more than 2/3 of the kids who were hospitalized with COVID have one or more underlying conditions. And their underlying conditions, frankly, include chronic lung disease, obesity, cardiovascular disease, and things like feeding tube dependence and chronic metabolic disease. But these don't include all of the comorbidities that we know exist for COVID. And also, of course, none of this includes one of the factors that we have now come to understand from our own research and from conversations we've had, that vitamin D deficiency is likely to be, if you add that in here, I'll bet that number 68% of kids hospitalized with COVID have at least one underlying condition. If you count vitamin D deficiency as an underlying condition, I'll bet that number goes pretty close to 1. Frankly.
Right. And if you were, we don't know. It's possible that the extremely compelling vitamin D data does not include kids, because in all likelihood that work was done on adults. Mm-hmm. And so that
kids are better able to synthesize vitamin D.
Right. So we have to leave open the formal possibility that the pattern, the small amount of COVID or the small amount of COVID disease that is worth talking about is not heavily impacted by D in kids. There's no reason to think that. The assumption should be in the other direction, that kids more or less mirror the adult pattern, but we have to leave open the possibility. Yeah. But nonetheless, from the point of view of, would you rather gamble on giving a young person with many more decades of life in front of them and much more development to go through a brand new technology vaccine that, oh, by the way, doesn't prevent contracting the disease and doesn't prevent transmitting the disease and doesn't seem to reduce viral load, but is really great other than that, right?
And you may well become dependent on more of it.
On more of it, right? So the number of boosters in a lifetime you might have to get is likely to be higher. Would you rather go that route with all of the uncertainties involved in all of that? Mm-hmm. Or would you rather try vitamin D and see whether the very minor problem that kids seem to have with COVID can be largely addressed because they have a cryptic vitamin D deficiency like everybody else?
Yes.
Or like everybody else living in the temperate zones.
And of course, we should say, as we, this is a point that we were hammering early on in our DarkHorse live streams, that we don't know the long-term effects of COVID. We don't know the degree to which children who have long haul COVID will, in fact, may have shortened life, may have, worse outcomes from long COVID because it has the potential to last for longer because they have a longer lifespan ahead of them, et cetera. We have no information on this, just as we don't on anyone, because this thing has been around for a long time at this point, but it's still only 2 years. Right. But that said, all of the information that we do have suggests that, yes, obesity is a risk factor across all age groups, and children are at lowest risk for bad outcomes from the disease. And they are at the same or in fact higher risk for bad outcomes, adverse events from the vaccines, especially boys, as we've outlined in other places on the show. And so, why is it that we are being asked to enable a one-size-fits-all policy? It's not because we're too dumb to track it. That may be part of the story, and you hear that from people. People are too stupid to keep track, and so you just need to give them one solution, and that's what they'll do. We all get into that headspace sometimes. My God, I don't want to make another decision. I just want to have brand loyalty, decision loyalty, something. I want to just vote blue. I want to buy that kind of toothpaste. I want to go to that restaurant and order that thing. I just want to not think about, I've got choice fatigue. That is gaming the fatigue that we all experience rather than actually an organic situation. People do not want to be handed single answers that don't actually fit all solutions and are being told that they fit all solutions, especially at the point that they come to realize that they've been lied to and that those lies have effects. They have effects on individual health, on societal health, on economic health, on all the healths.
Yeah, it doesn't make any sense that this is about we can't handle the complexity. For one thing, much of the vaccine hesitancy surrounds a lot of us having seen the complexity and saying, actually, there's too much uncertainty here to contemplate this. And the longer that we wait and the more we learn, the more frightening the picture that emerges from what is apparently already known becomes. So I would point out in thinking about this question, you're comparing it against a lot of unknowns with respect to how much hazard there is to kids in these brand new novel vaccines. That would be true if there had been no observation of harm whatsoever, but we are not in that circumstance. In fact, even in Pfizer's trial on kids, which was tiny, it was like 1,200 kids, there was an absolutely serious adverse event with permanent effects. The Maddie Daguerre case, I think that's how you pronounce her name. It may be Daguerre. But in any case, this was a girl, really a hero of the pandemic, somebody who volunteered to test the vaccines because she wanted to contribute to the solution to COVID. She now has a feeding tube, is permanently in a wheelchair. And the reaction of Pfizer was to unblind very quickly. And basically she was written down in the report as if she had had stomach upset. This is a person who is now on a feeding tube, right? This is a person who is permanently injured in a group of about 1,200 kids. That's not an insignificant number. In 1,200 kids, even a very high rate of very serious reactions could have been missed. But in this case, there actually is a person. She has a name and she has a life ahead of her. And, Pfizer is effectively pretending that she doesn't exist or is faking or something like that. And it's preposterous. And the fact is, parents have a right to know this, and they have a right to say no to these things.